Is your HPV test related to cervical dysplasia, CIN? Imagine a tiny virus that can influence the health of your cervix. That's what the human papillomavirus, or HPV, is all about. The HPV test is designed to detect high-risk types of this virus in cervical cells. Now, you might wonder how this connects to cervical dysplasia, also called cervical intraepithelial neoplasia, or CIN. Well, the answer is quite direct. The HPV test is closely linked to cervical dysplasia because it identifies the presence of high-risk HPV types that can cause abnormal cell changes on the cervix's surface. Cervical dysplasia involves abnormal growth of cells on the cervix, which can range from mild to severe. Mild changes are called CIN1, while more serious ones are CIN2 and CIN3. If left untreated, these changes can sometimes develop into cervical cancer. High-risk HPV types, especially HPV-16 and HPV-18, are the main culprits behind these cellular changes. When the HPV test detects these high-risk types, it signals an increased risk for developing cervical dysplasia. It's important to understand that not every HPV infection leads to dysplasia. Many infections are temporary and are cleared by the immune system without causing any cell changes. That's why a positive HPV test doesn't automatically mean you have dysplasia but indicates a higher chance of developing it in the future. This is why HPV testing is a vital part of cervical cancer screening programs. When combined with a pap smear or cytology test, healthcare providers can get a clearer picture of your cervical health. Research shows that HPV testing is very effective at identifying women at risk for high-grade cervical lesions. For example, women who test positive for high-risk HPV are often referred for further examination, like colposcopy, which allows doctors to look closely at the cervix and identify any abnormal tissue. The amount of virus present, known as viral load, especially with HPV-16, can also give clues about how likely it is that abnormal cells might develop. Larger studies confirm that HPV testing can catch most cases of serious dysplasia early, and women who test negative are at low risk of developing cervical problems soon after. It's also worth noting that HPV infection is necessary but not enough on its own to cause dysplasia. Other factors like smoking, immune health, and nutrition can influence whether an HPV infection progresses to abnormal cell growth. That's why regular screening, including HPV testing, is so important for early detection and prevention. In summary, your HPV test is directly related to cervical dysplasia because it detects the presence of high-risk HPV types that can cause abnormal cell changes. If your test comes back positive, your healthcare provider will likely recommend further tests to check for any signs of dysplasia. Catching these changes early can help prevent the development of cervical cancer. Remember, always consult your healthcare professional for personalized advice and screening recommendations to keep your cervical health on track.